Hello, and welcome to the PainScored platform. My name is Dr. Marsculci, and today I'll be showing you how to use PainScored.com. Insurers have released programs over the past several years to encourage physicians to proactively, rather than reactively, manage patients' health. Realizing that proactive management of disease and illness requires physicians' involvement, billing codes were created to compensate physicians for their time spent between appointments and during office visits to help patients stay on track with their treatments and achieve better health. These reimbursement codes can generate up to $200 per month per patient. That's where PainScored comes in. Today, I'll show you how to use the PainScored platform in under 3 minutes. First, log into PainScored.com on your PC or download the application from the Apple or Android stores. You may create an account by selecting Register and filling out your information. Once submitted, click the link in your email to verify your email address is correct. To confirm that you are a physician, please send us an email at info@patientpremier.com or by visiting the Physician Access or Contact Us pages on PainScored.com. We will then have your account converted into a physician's account, as well as send you more information about billing and reimbursement. Once your physician account has been activated, return to PainScored.com and log in. On the first homepage, you will see all of the patient accounts that you have access to. Patients can automatically grant you access to their accounts by searching for your name and clinic. You may enter this information under your account settings. Alternatively, you may invite patients by selecting Send Invite. Here you have the option to send a patient invite by email or text. All that is required is the patient's contact information, a unique identifier, your clinic name, if you have a preferred survey for them to take, and an optional personalized text. When your patient has taken more than one survey, their survey reports page will show trends and insights over time. PainScored pain diary entries are designed to be completed in 1 minute or less with the easiest user interface possible. We look at functional improvement, quality of life, as well as pain scores. These are aggregated over time into powerful reports, allowing you to identify dosage ceilings, medication failures, or opioid-induced hyperalgesia, offering greater patient insights with potential integration of predictive algorithms for treatment success and failure, along with other surveys that track mood, cognition, and aberrant behaviors, all of which have the potential to be reimbursable by insurers. That was a brief introduction. We anticipate you'll find out more of the advanced features as you use the platform. Please get in touch with us for support or feedback at info@patientpremier.com or by visiting the contact page on our website.